Thank you very much. I'd like to begin by saying that we're continuing to negotiate with the Democrats to get our great workers and small businesses all over the country taken care of. I think we're getting close to a deal. Could happen. Could happen. A lot of good work has been going on, and we could have an answer tomorrow. And we're going to see what exactly does take place. We're also looking at helping our hospitals and our rural hospitals who have been hurt very badly. The rural hospitals for a long time have not been treated properly. We're looking to help them and beyond. So we're looking at hospitals also as part of the package. And we'll see how that all comes out. But a lot of good things are happening, some very good negotiations. Just got off the phone with the Secretary of the Treasury, and we have some very good negotiations going on right now. And I think you could have a nice answer tomorrow, but we'll see. America continues to make steady progress in our war against the virus. As of today, we've tested 4.18 million Americans. That's a record anywhere in the world. The United States has now conducted more total tests than all of the following nations combined: France, the United Kingdom, South Korea, Japan, Singapore, India, Austria, Australia, Sweden, and Canada. And our testing is expanding very rapidly by millions and millions of people. So we've done more testing than all of these countries combined: France, United Kingdom, South Korea, Japan, Singapore, India, Austria, and Australia, Sweden, and Canada. That's something, right? We're doing a great job. This team is an incredible team, and that includes Army Corps of Engineers, a lot of our military people, our admirals, our generals. One of our great admirals here has done an incredible job. You haven't slept too much in the last 2 months either. Look at him. But somebody said to me, "President, you look tired." I said, "I should be tired. We should all be tired, but we have to win, right?" Yes, sir. Tomorrow, the Vice President will lead a call with our nation's governors from FEMA headquarters, Mike, to review what more they can do and do together to develop locally tailored testing strategies. Working very hard with governors now on testing. We want to help them out. Before the call, we'll send them a full list of all of the large laboratory machines in the states. They have a lot of machinery in the states that some aren't that aware of, but they're there, and they're really high-quality machines, by the way. And the potential capacity of those machines, if they're fully utilized. A couple of them didn't know that they could be utilized in a different manner. They were only up to 10%, and they can go 90% more. Many governors are still relying on their state laboratories rather than the full and much larger capacity that is available to them. As an example, commercial laboratories such as Quest and LabCorp, these are massive laboratories that can handle a lot more than they're being sent. A few days ago it was at 30%. They're only at 30% capacity now. I don't know, they're probably the same, but they have a lot of capacity. In addition, academic laboratories, big research labs, there's tremendous capacity out there. And some of them want the fast, the instant Abbott machine, which just came about due to the research during this little short period of time, and it's very quick. But these labs can do it very quickly also, and they're massive. They can handle much more than the small machine can handle. We continue to procure millions of swabs, test collectors. I have something here. Just happen to have it's a swab. Looks innocent, not very complicated. Anybody like to see what it looks like? Should I open it? Does everybody? Open it up. I will. This is what it's about, right? Does it remind you of something? It reminds you of this, right? One's a swab, one's a Q-tip. It's actually different. It's very sophisticated, actually, but it's a little bit like, so this is the swab. And we've ordered a lot of them. They have a lot of them. Some of the states, they were shipped to states, and the states don't know where they are. But that's it. Why don't we give this to Karen? Perhaps she'll take an extra test. Right? But this is a big deal. And we're working on it, and we're working with the companies. And I think in the end, we're going to have a tremendous success. Nobody is close to us. No country is close to us. In fact, and I appreciate it very much, the Wall Street Journal wrote a fantastic piece, a highly respected gentleman, Christopher DeMuth, and this piece was just in the Wall Street Journal, weekend edition, and Trump rewrites the book on emergencies. That's what's happened, too. And we just read one paragraph. He's given pride of place to federalism and private enterprise, lauding the patriotism and proficiency of our fantastic governors and mayors, meaning I do call them fantastic when it's appropriate, and our incredible business leaders and genius companies. I guess I probably use those terms too, when they're doing a good job. When they're not doing a good job, I don't use those terms. Our heroic doctors and nurses and orderlies and our tremendous truckers, they have all done good jobs. By shouting out many of them by name and documenting their deeds on a fully daily basis, he has vivified the American way in action. Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused. When asked why he has not issued orders for nationwide home and business lockdowns, he has emphasized that the intensity of the epidemic varies widely and is best met by calibrated state and local judgments. That's the judgments of governors and local people. And added pointedly that such steps would conflict with the Constitution. But very importantly, he's just a very respected gentleman. To see this was a very nice feeling. Not for me necessarily, but for all of the people that have worked with us. I mean, they've worked so hard, and we've developed tests that are so fantastic. We've come up with things that nobody had ever heard of, and we did it during this pandemic. We did it under pressure. It's called reaction under pressure. It's pretty amazing what our people have done, and that includes all of our military people and our CDC, just about everybody you can imagine, including Tony and Deborah. And they've worked long hours. There's nobody that's getting a lot of sleep. We're close to finalizing. I want to thank the writer, Christopher, of this article, and it's a great article. That was, frankly, the least of it, what I read. It was a great article. We appreciate it. We're close to finalizing a second partnership through which a U.S. manufacturer would convert its existing plant to produce over 10 million additional swabs per month. And we should be ready to announce this in a very short period of time. We also are going to be using, and we're preparing to use, the Defense Production Act to increase swab production in one U.S. facility by over 20 million additional swabs per month. We've had a little difficulty with one, so we're going to call in, as we have in the past, as you know, we're calling in the Defense Production Act, and we'll be getting swabs very easily. Swabs are easy. Ventilators are hard. Ventilators are a big deal, and we are now the king of ventilators. We have so many ventilators. You know, I said nobody that needed a ventilator has been turned down. It's pretty amazing. Nobody. We're working with the world-class team at Oak Ridge National Laboratory to use its injection molding capacity to potentially produce over 10 million collection tubes per week. That's tremendous numbers. In the meantime, the Supply Chain and Logistics Task Force continues to surge testing and needed supplies all throughout America. Mike's team and the task force, they just met. They've been meeting virtually every day. And it's a great team, right? It's a great team. They've been doing a great job, Mike. You've been doing a great job. Many governors are doing this incredible work, and they're working with us very closely on testing and working in their states. And again, it should be a local thing because it's all these points within a state. But we're helping them a lot. and we want to help them a lot. We're going to help them more than a lot, actually, if you think about it, with what we've done. Think of it, we've done more than all those countries combined. We're encouraging them to share their successful strategies with other governors. Some of the governors are doing a better job than others. The robust capacity that we've brought online will empower governors to deploy sophisticated strategies so they can safely reopen their states. Some people believe in testing very strongly, and other people believe in it less strongly, but still it's a very good thing to have. I think we can say that. Some people believe in it like they can't exist without testing, and other people don't believe in it nearly as much. They can see how they're doing, and they feel how they're doing. And they've been pretty vocal about that. I think you know pretty much who I'm talking about. But I believe if they want it, we should give it to them and get it for them and work with them. You must remember that the governors wanted to have total control over the opening of their states, but now they want to have us, the federal government, do the testing. And again, testing is local. You can't have it both ways. Testing is a local thing. And it's very important. It's great, but it's a local thing, and we're going to get it done to a level in a very short period of time, because all of the swabs are coming in, all of the necessary materials. A lot of them, as I said, are already there, but a lot of people don't know that yet. But we'll be doing testing at a level. Already, we're doing testing at a level nobody's ever done before, but we'll be doing testing at a level that the biggest tester in the world will be very happy very soon. And it's very much like ventilators. You don't hear the word mentioned, and that's much tougher when you have to build these machines. We built thousands of machines. We'll more than help the governors, and we'll make sure that everything goes well, just like it did with ventilators, just frankly like it did with face masks, on a much easier subject. As face masks, again, everything's easier than a ventilator. Ventilators are tough. But now, I spoke yesterday with the president of Mexico and with various other countries. We're going to be helping them with ventilators. We have tremendous numbers of ventilators. In fact, I understand that Governor Cuomo is going to be sending up to Massachusetts some of the excess ventilators that we were able to get, and that's great. I think it's a great thing. The number of new hospital admissions is also significantly down. When you look at these numbers, it's a good thing to see, other than the fact that we also know how people have been just ravaged by this curse, by this horrible scourge, plague, call it. It's got many different names. In many of the hotspots, including a 50% decline over a 9-day period in New York City. That's a fantastic decline. It's a beautiful thing to see after going through the opposite. We continue to see improvement with declining trajectory of cases in Seattle, Detroit, New Orleans, Indianapolis, and Houston metro areas. More evidence that our aggressive strategy is working, and I thank the American people for their selfless devotion. The American people have done a hell of a job. We're saving countless lives, though, and again, I'll say it because I always wanted to say, well, can you leave it open? Nobody ever heard of anything like this. Not since 1917, more than 100 years ago, has anything like this happened. And in those days, they had no real communication, so you couldn't say, go inside, people just died. Almost 100 million people, it's reported. It's tough. So, the American people, what they've done is incredible. And they've learned a lot, You see people picketing a little bit, and they want to get out. They want to get out and get back with their lives, and that's good. But they have learned a lot. They've learned about distancing, even now, at least until this thing totally goes away. They've learned about their washing their hands and all of the different things that we've been talking about ad nauseum for so long. And they get it. They get it. And some places the governors are ready to go, and other places they can't go yet, and they won't go. They have to have it safe. I want it to be safe too. It has to be safe. And again, I have to say this. I can't emphasize it strongly enough. I'm probably going to show you charts of some of the countries that are really having trouble. And one in particular is having a massive problem where they said let's go. We're just going to keep going. Well, they're the lines that we're famous for now. Some are flat and some are up. This is like a rocket ship. This country is, and they decided, let's go and let's wing it. It's, they thought it was okay, but it's a problem. It's a big problem. And there's another couple, there's one in particular that everybody thinks did it, but the people are staying in. Okay, the head of a country doesn't have to say stay in. These people are smart people. They know what's going on. They see what's going on. So they don't have to say, they can say they're not doing that, but the people are staying inside. There are not a lot of people outside sitting at cafes, despite what the mode of a country is. But if you look at Europe, most countries have done this. A couple tried not to. Italy tried not to, and they held it. And Spain tried not to. They went that way. France tried not to. I mean, nobody wants to do this. It's a brutal step. We're going to close down your country. Who ever heard of a thing like this? But we would have had millions of people die if we didn't do this. Millions of people. And I believe that, Mike. I think, in looking at things that we've been looking at over the last couple of days, I think, and really over the last couple of weeks, from the time we did it, shortly thereafter, I said we made the right decision in closing down, made the right decision on borders, banning people coming in from China, banning ultimately people coming in from Europe. But we would have had millions of deaths instead of, it looks like we'll be at about a 60,000 mark, which is 40,000 less than the lowest number thought of. So this isn't a case where people would say, oh, we would have had that number. It's similar to a flu. It's not the same thing as a flu at all, because if we wouldn't have done anything, you would have had, so a flu would have 35. It goes from 27 to 35, 40, 50 sometimes. It's over a long period of time, much different. It's even a much different death, to be honest. It's a much different death. This is violent. CMS is finalizing new guidelines for doctors and patients to resume elective surgeries. It's a big thing. A lot of hospitals were closed. They couldn't do any elective surgeries. They'll be able to start doing that. Procedures and medical care that needs to be done in person. As long as the rate of infections remains low in a community, we want patients to be able to go to their doctors, get clinically tested, and have work done, surgeries, receive treatment for chronic conditions, and resume preventative care. So we'll be allowing that to happen very soon. We had no capacity in the hospitals with what happened with the plague. We had no capacity to do it. If your doctor believes you need a treatment in person, you can get a treatment now. You can and should get a treatment now. We are asking that healthcare facilities have plans in place to keep patients safe during their visits. Some places like New York, New Jersey, where they really got hit hard, it's going to be a little bit tougher. They've done a great job, but they really were a center. I mean, they were a center. I was watching that. It was incredible. But now they're leveling off, and I think they'll be coming down very soon. Administrator Seema Verma will be telling you a little bit more about it. Mike's going to say a few words. Seema will then speak, tell you a little bit more about that. My administration continues to execute our massive military operation to supply our hospitals with equipment they need and beds if necessary, but it looks like we're totally covered on beds. We have plenty of beds. It's highly unlikely. That would be bad news if we needed more beds, but it looks like it's going just the opposite direction. I want to thank Governor Cuomo, the relationship there for this whole thing. We're building hospitals. It was very good. We built a little bit more than we needed, and that's good, as opposed to building a little bit less. That's not good. But he's worked very well with us. The governor of Louisiana has been great on the bed, on that whole situation with the beds. Frankly, the governor of Michigan was very good with us on beds. You know, it's a very complex subject. You need buildings, or you have to do tents, or you have to do a lot of different things, a lot of different ways. But the Army Corps of Engineers was fantastic. They were fantastic. Florida, likewise, Governor DeSantis. And I could name probably 6 other locations I'll tell you one, California was fantastic. He was really good. He was really good, and I appreciate the fact that he said what he wanted to say, and he wasn't letting the press force him into saying something that he didn't want to say. So I appreciate it very much, Governor of California. He really he worked very hard. We worked together. He worked very hard. The federal government is currently procuring more than 100,000 ventilators through new production or purchases, with thousands already delivered. We've delivered thousands of brand new ventilators all throughout the country. New York would be, I guess, the biggest user. And they are now taking some of their excess ventilators, which is great, and they're sending them up to Massachusetts. I think it's 400. And that's a great thing. Our total supply of ventilators continues to exceed by a lot total expected demand. Governor Cuomo said today that no one who needed a ventilator was denied a ventilator. That's a beautiful statement. I appreciate it. And all governors are in that same position. We do have a clip that I thought would be appropriate to put up today. It'll take 2 minutes, and I think you'll find it interesting, but we appreciate it. And let's see if we can do that. You'll turn out the lights, and we'll see if we can do that. Thank you.